So the symptoms of a traumatic brain injury derive from the injury itself. I'm going to emphasize just a few of the symptoms that you're looking at. One of the most common that you will see, and I'm emphasizing this because you don't generally see many of these patients early on in their head injury. You're going to be seeing these patients down the road, maybe 6 months, a year or longer. And they're going to have a lot of these symptoms that I'm going to talk about as being during the acute phase as well, but they last. So they're going to come to you with low energy and easy fatigability, one of the most common symptoms that presented in my clinical practice. In addition to that, difficulties concentrating for long periods of time, paying attention, highly distractible, which in itself is very serious. And another big issue that you will see is slow processing speed. Amazing number of my patients would tell me that they knew where they were going, they'd been there before, and they would drive past their turnoff before they recognized it had come upon it. So they have slow processing speed. And you can see why slow processing speed, difficulty with concentration and attention, leads to more susceptibility to another head injury, because you're not totally there, if you will, to be as attentive as one would like to be. Sleep disturbances, and obviously sometimes lingering pain and body complaints may linger as well. Another symptom that the clients of yours may recognize, they really struggle with pulling back words that they know commonly or names of people, and they just feel like their IQ dropped about 40 points from where they were before. And the sleep disturbances are very, very common as well. Lastly, one cannot say too much about the emotional consequences of a traumatic brain injury. Depression is very common, not only from the acute injury and maybe the chronic effects of that, but because they cannot do or function the way they used to be. They feel different. They just don't feel like themselves anymore. So depression, anxiety disorders are very, very common as a consequence of brain injuries or concussions.